So I'm Dr. Senhaji Rhazi. I'm from Casablanca in Morocco, and I am associate member of IVF Center, and we have a collaboration with fertility laboratory in France, which is called Neurelia. And my topic today is about the relevance of the use of dietary supplements in male and female infertility. So I've seen that for the session of today, there are a lot of subjects. So I think fertility is one of the important subjects that we present. What about these dietary supplements? First of all, I would like to present to you Dr. Cohen, who is the president of Neurelia Laboratory, who has made his a former researcher at INSERM, the Institute of Health in France. He's gynecology and very interested in fertility. So he made a lot of papers in literature that proved the efficacy of our dietary supplements. So what is the problem? Our strategy in the laboratory is to target pathology. So for any problem, we have to know which the problem is it to have the best solution. And we have we have made researchers that demonstrate that there is an instability of DNA methylation, which leads the accumulation of homocysteine and the overproduction of ROS. The ROS are the oxygen-free radicals. So for the accumulation of homocysteine, we have the solution by stopping the transformation of homocysteine, and for the overproduction for ROS, we have neutralized them, and leading the stopping of instability of DNA methylation. The first, excuse me, because in my screen I have a problem. So just one moment to just one moment. I'm sharing, so I do like that. So what about the methylation? The first pillar is to stop the instability of this methylation. And it works. How does it work? It works by stopping the oxygen-free radicals and the deviation of the methylation. So this figure, with this figure, we can see that stopping the ROS and the homocysteine can lead a stability of methylation. And we know that methylation, the defect of methylation or the instability of methylation can make genetic instability, gamete apoptosis, obryogenesis arrest with miscarriages and malformation, and finally psychiatric illness. All these things we have made researches, and we've seen that our products have a good efficiency for this instability. So the ROS, the oxygen-free radicals, when they are accumulated, they cause nuclear decondensation and DNA fragmentation. How do we do that with the different products that we give? Is with stopping the rise of homocysteine. So we integrate them to the methionine cycle, and we give a synthetic folic acid, who is different from the classical vitamin B9, the classical acid folic, who is less efficient than the synthetic folic acid integrated with the 5-methyl tetrahydrofolate. Before I leave this figure, I would like to insist about the CH3 with the complement and can lead to stability of methylation. So the oxidative stress and the mutation of MTHFR affects gametes and early embryos and can be transmitted transgenerationally with the instability of the DNA structure. So what we offer? We have a lot of products, and as I said before, for each problem we have to give a specific treatment, a specific dietary supplement. For the acid folic, we have the synthetic acid folic, which is very efficient to fight against birth defects and bypasses MTHFR mutation. So this supports nucleic acid synthesis and maintain the cell cycle with and leading to prevent vitamin B9 deficiency and participate in the proper closing of the neural tube, as we know all, and reduce the risk of development cleft lip and palate and limit congenital hurt. It is all these problems are responsible of more than 300,000 deaths before the first month of pregnancy. We have also active folic, who is integrated by vitamin B3 and NADH associated with 5-MTHF and is especially recommended for women who have history of miscarriage with association of mutation of MTHFR. So it supports energy metabolism and can be indicated for women before pregnancy until the end of the first trimester of pregnancy. We have also developed for female and male fertility what we name tetrafolic, reduce the risk of embryonic malformation, and all what I'm saying is have been published, and we have the in France to commercialize this these products. So the main problem is the mutation. What we demonstrated is the main problem is the mutation of the MTHFR and the hyperhomocysteinemia. And with this figure, we see that for women with before treatment and after treatment, specified treatment, because for each problem we have a specified treatment, we see that the homocysteine concentration before and after supplement change and leads for more pregnancy. We have this paper, we have published it in 2020 in the Journal of Gynecology and Obstetrics. And the result of tetrafolic supplementation is also very clear for pregnancy after 3 months of treatments. So the same figure as before. So we limit the oxygen-free radicals and the accumulation of homocysteine, who leads and stability of DNA methylation. So what about male infertility? Male infertility, we know that the physical characteristic of sperm is about motility, survival, and its membranes. And for the genetic information, we can have it by DNA fragmentation and the degree of the condensation of DNA. And we have the solution. We have fertibiol for men who strongly reduce antioxidants and give less fragmentation of the membrane. So we recommend a sequential treatment for 1 month by fertibiol and after 3 months by Condensil. So why this sequential treatment? Because we have remarked that when we give more than 1 month of fertibiol, we have the contradictory effect by a new condensation. So we recommend after our researchers to give only 1 month for fertibiol and relied by 3 months of Condensil. The effects of this treatment with association fertibiol and Condensil, and only Condensil gives more efficiency than no treatments. And this paper, these statistics have been published in a scientific paper. Also, it gives more pregnancies, less miscarriage, and more live births. So we have, for the male fertility, prokaryote men, with its lot of effects that we cited before, and the results for pregnancy. We have also prokaryote for women who preserve the quality of oocytes and protect the membrane. It has a complete antioxidant action. So here is the statistics about the efficacy of supplements. And for female infertility, we have also other problems. We can have a mutation of methylhydrofolate with clinical mute cases. We can have other specific problem like that we see in infertility, like PCOS, polycystic ovarian syndrome. We can also have endometriosis, who gives a lot of inflammatory, and the premature ovarian insufficiency. For all this problem, we have made researches and find that the stress oxidative and the hypermethylation and the instability of DNA methylation give less success of pregnancy. So what about the mute clinical mutation of MTHFR? There is, with our specified supplements, we reduce the risk of embryonic malformation and prevent and support the entire monocarbon cycle, who leads stopping the MTHFR mutation. For PCOS, we know that there is a hormonal dysregulation characterized by hyperandrogenism and insulin resistance who leads immature follicles. And the product that we developed was called polycystics, leads for more success in pregnancies. And we have a patented ratio of carnositol 1:6, who leads for a better treatment of fertility in this context. What about endometriosis? We know that the inflammatory disease is dependent on estrogen, and the cyclic inflammatory reaction leads a local swelling that activates nociceptors and a lot of pain. And under the influence of ovarian hormones at each cycle, they proliferate and produce natural killer cells. The natural killer cells are defective, and there is a production of nuclear factor that, like a kappa factor, that leads cytokines and maintain inflammatory reaction. So there is a vicious cycle that we have stopped, and that's what we do with our supplements. So the inflammatory gives more stress, and the stress leads to more inflammation. So the first dimension of our treatment is to control the natural defense and an active action with antioxidant and anti-inflammatory molecules. The second dimension is about bioactive vitamin B9, so 5-MTHF, so the methyl hydrofolate synthetic acid folic is more effective than the natural one. So as we see in this figure, we have a circle, a vicious circle of stress oxidative as a primary trouble, who leads to oxidative stress, and the oxidative stress leads to inflammatory trouble, and both produce a radical, oxygen-free radical, and less antioxidant is produced. What about the aromatase? The aromatase is transforming testosterone androgens to estradiol, to estrogens, who stimulate COX-2 and gives more prostaglandin and continue the inflammatory processes. So for other cases of premature ovarian insufficiency, we have proved that there is no oocyte maturity. This oocyte maturity is provoked by less energy production and maturation. So by our products specified, we have proved that it gives more energy to oocytes and stimulate maturation by putrescine. So we have two products, Baturovo and Gynecology, that gives more efficacy to the maturation of oocytes. And all these effects are by ATP and concerning FSH and LH cycle. So Material enhances oocyte quality and improve oocyte maturation with managing emotional stress and oxidative stress with natural supplements. Genostim also is an antioxidant that gives better maturation of oocytes. Here in this figure, we explain that all this, the mechanism in the oocyte of the maturation and energy is controlled by mitochondria. So we act at this level. Nadivit B3 is the product that promotes mitochondrial biogenesis and corrects meiotic spindle organization. So this is our products. And in conclusion, we can, I will conclude like my introduction that we can't give any treatment without specifying the problem and identifying it. So each problem has an adapted complement. We have to do before any treatment appropriate dosage of DFI, DSI, so fragmentation and condensation, the homocysteine, the acid folic, and vitamin B. And we have to identify the mute MTHFR problems to correct it correctly. So thank you for assisting. And if you have any question, I'm in this post.